Your body has a kill switch. 14 of them, actually. One turns your muscles to stone while you're wide awake. One convinces your brain that water itself is the enemy. One is already inside a third of the planet right now, waiting. By the end of this video, you'll know exactly which one is most likely to get you, and exactly what it feels like in the final hour. Every disease has a signature. Not just a cause of death, a process. A specific, repeatable sequence of things going wrong inside a human body, refined over thousands of years of medical case studies, autopsies, and survivor accounts. Doctors have documented these processes in brutal detail because understanding exactly how something kills you is the first step to stopping it. This video walks through 14 of the deadliest diseases in history, some ancient, some modern, some still active right now, in the order they unfold inside you, from first symptom to final moment. Once symptoms start, rabies has never, not once in recorded medical history except a tiny handful of experimental cases, been survived. Not with modern medicine. Not in a hospital with every drug available. That's the number that should scare you. Untreated, symptomatic rabies kills essentially 100% of the people it infects. It usually starts with a bite. A dog in a country with poor vaccination coverage. A bat that snuck into a bedroom while someone slept. A scratch so small the victim forgets about it. The rabies virus doesn't attack the bloodstream the way most infections do. It travels through the nerves themselves, crawling from the wound site toward the spinal cord and brain at roughly 1 to 2 centimeters a day. That's why a bite on the ankle can take months to turn deadly, while a bite on the face can kill in days. The virus simply has less distance to travel. The first symptoms are almost insultingly mundane. Fever, headache, fatigue, a strange tingling or itching right at the old wound site, even if it's fully healed. Doctors call this the prodromal phase, and it's often mistaken for the flu. But within days, the virus reaches the brain, and everything changes. This is where rabies becomes one of the most feared deaths in medicine. Patients develop hydrophobia, a terror of water so severe that the mere sight of a glass, or even the sound of running water, triggers violent, agonizing throat spasms. The virus has hijacked the brainstem's swallowing reflex so completely that the body convulses at the idea of drinking, even while the patient is dying of thirst. Some patients also develop aerophobia, gasping and spasming at a puff of air blown toward their face. Between these episodes, patients are often lucid, fully aware, talking to their family, understanding exactly what is happening to them, terrified of the next spasm. Agitation gives way to hallucinations, then seizures, then a slow shutdown of the brainstem itself, the part of the brain that controls breathing and heartbeat. Death typically comes within 2 weeks of the first neurological symptom, almost always from either respiratory failure or cardiac arrest, in patients who are, cruelly, still mentally present for most of it. But that's not even the worst part. Rabies is one of the very few diseases on Earth that's essentially 100% preventable with a vaccine, even after exposure, if given in time. Which means almost every rabies death in the modern era is a death that didn't have to happen. Tetanus doesn't come from a virus at all. It comes from a bacterium, Clostridium tetani, that lives in soil, dust, and manure almost everywhere on the planet. All it needs is a way in. A rusty nail, a deep splinter, a wound that closes over before it's properly cleaned. Inside a low-oxygen wound, the bacteria release a toxin called tetanospasmin, one of the most potent poisons known to biology. It travels up the nerves toward the spinal cord and does something almost diabolical. It blocks the signals that normally tell muscles to relax. The result is that muscles across the body lock into permanent, involuntary contraction. It usually starts in the jaw. Patients can't open their mouths, which is why tetanus earned its old nickname, lockjaw. Then the neck stiffens. Then the back, which can arch so violently and so completely that patients bend backward into a rigid bow shape. A posture doctors call opisthotonous, sometimes with only the back of the head and the heels touching the bed. Retention hook. Here's the part almost nobody knows. The spasms are often triggered by completely ordinary stimuli. A light switch flicking on. A door closing. Even a raised voice can set off a full-body convulsion so violent that patients have fractured their own spines and snapped their own long bones from the force of their muscles contracting against themselves. The real killer, though, is the diaphragm and chest wall. When those muscles lock, breathing becomes impossible. Patients suffocate not from an outside cause, but from their own body clenching shut around their lungs. Before vaccination and modern intensive care, tetanus killed roughly 1 in 4 people who contracted it, and in newborns infected through unhygienic umbilical cord care, the death rate ran even higher. Cholera has a nickname among doctors, the Blue Death, because that's what it does to you. Caused by the bacterium Vibrio cholerae, usually from contaminated water, cholera attacks the small intestine and triggers catastrophic, uncontrollable diarrhea, up to a liter of fluid loss per hour in severe cases. That's not an exaggeration used for shock value. It's a documented clinical figure. The body simply cannot replace fluid that fast. Recap bridge. So far we've covered a virus that hijacks the brainstem and a toxin that locks the muscles. Cholera works differently. It's pure, brutal dehydration, moving faster than almost anything else on this list. As fluid drains out, blood volume collapses. Skin loses its elasticity. Pinch it, and it stays tented instead of springing back. Eyes sink into their sockets. Hands and feet, starved of blood flow, take on a grayish-blue tinge, which is where the nickname comes from. Untreated, a previously healthy adult can go from first symptom to death from catastrophic dehydration and shock in as little as 12 to 18 hours. The devastating irony is that cholera is one of the most treatable diseases in existence. A solution of clean water, salt, and sugar, administered orally or intravenously, saves the vast majority of patients. Yet it still kills tens of thousands of people a year, almost entirely in places where clean water and basic medical access don't exist. If rabies and cholera are fast, tuberculosis is the opposite, and that's exactly what makes it, historically, the single deadliest infectious disease in human history. Some estimates put TB's total death toll over the last 2 centuries above 1 billion people. TB is caused by Mycobacterium tuberculosis, a bacterium that primarily infects the lungs, though it can spread almost anywhere. It kills slowly enough that it was romanticized for centuries. Victorian writers called it consumption, because it seemed to consume its victims from the inside, wasting them away over months or years. The disease eats through lung tissue, creating cavities that fill with dead cells and bacteria. Patients develop a chronic cough that eventually brings up blood, a symptom so common in TB's history that coughing blood into a handkerchief became a literary cliché for tragic, romantic death. In reality, there was nothing romantic about it. Relentless fever, night sweats so severe patients would soak through their sheets, and a slow, grinding weight loss that could strip more than a third of a person's body mass before the end. Death from advanced TB usually comes from one of 2 routes. The lungs finally fail to move enough oxygen into the blood, or a cavity erodes into a major blood vessel and the patient drowns in their own blood within minutes. A death doctors call a massive hemoptysis event, and one of the more violent ends to an otherwise slow disease. Retention hook. Here's something most people don't realize. A huge percentage of hospital deaths aren't officially caused by the disease that put the patient there. They're caused by sepsis, a condition that can be triggered by almost any infection on this list. Sepsis happens when the body's own immune response to an infection spirals out of control. Instead of fighting the infection locally, the immune system floods the entire bloodstream with inflammatory chemicals. Blood vessels leak. Blood pressure crashes. Clotting goes haywire, forming microscopic clots throughout the body while simultaneously losing the ability to clot at the site of an actual wound. Organs start failing in a chain reaction. Kidneys shut down first, often. Then the lungs fill with fluid. Skin can mottle into a lace-like purple-blue pattern as circulation fails at the extremities. In the most severe form, septic shock, blood pressure drops so low that vital organs are starved of oxygen even though the heart is still technically beating. What makes sepsis so uniquely dangerous is its speed once it tips into shock. Mortality risk climbs by several percentage points for every hour that treatment is delayed. A patient can look stable in the morning and be in multi-organ failure by nightfall. It remains one of the leading causes of death in hospitals worldwide, precisely because it doesn't look like one specific disease. It looks like the body's own defenses turning into the weapon that kills it. The plague killed an estimated 1/3 to 1/2 of Europe's entire population in the 14th century. That's not ancient exaggeration. Modern genetic analysis of mass grave remains has confirmed Yersinia pestis, the same bacterium, as the cause. Bubonic plague, spread mainly through fleas from infected rodents, causes the lymph nodes, usually in the groin, armpit, or neck, to swell into painful, blackened masses called buboes, sometimes growing to the size of an egg or larger. Left untreated, it kills roughly 30 to 60% of those infected, usually through the bacteria eventually overwhelming the bloodstream. A condition called septicemic plague, where skin and extremities can turn black from tissue death, the origin of the name Black Death. Recap bridge, we've now covered slow killers like TB and fast ones like cholera. Plague can be either, depending on which form takes hold. The far deadlier form is pneumonic plague, where the infection settles in the lungs and spreads through the air via coughing. Untreated pneumonic plague is close to 100% fatal, and death can come within 24 hours of the first symptom, making it one of the fastest-killing infectious diseases ever recorded. And here's the part that should genuinely unsettle you. Yersinia pestis hasn't gone anywhere. Small numbers of plague cases still appear every single year, including in the rural United States, usually from contact with infected rodents or their fleas. Smallpox killed an estimated 300 million people in the 20th century alone, more than every war of that century combined. It's also the only human disease ever fully eradicated, declared gone by the World Health Organization in 1980 after a global vaccination campaign. The virus caused a distinctive, agonizing rash that progressed through stages: flat spots, then raised bumps, then fluid-filled blisters, then pus-filled pustules covering the entire body, including the palms, soles, and inside the mouth and throat, making eating and drinking excruciating. In severe hemorrhagic cases, bleeding occurred under the skin and from mucous membranes, turning the skin a deep, dark red-black, a form that was almost universally fatal, often within days. Survivors were frequently left with deep pitted scarring across the face and body, and smallpox was also a leading historical cause of blindness. The overall fatality rate for the common form of smallpox was around 30%. The rarer hemorrhagic and flat types killed nearly everyone they touched. It's a sobering reminder tucked into an otherwise triumphant story. Humanity's greatest medical victory came at the cost of hundreds of millions of lives before we figured out how to win. Not every killer on this list is exotic. Some are sitting quietly inside people you know right now. A heart attack happens when a coronary artery, one of the vessels feeding the heart muscle itself, becomes blocked, usually by a ruptured plaque of cholesterol and fat that triggers a blood clot. Downstream of that blockage, heart muscle begins to die from lack of oxygen within minutes. In a massive or widowmaker heart attack, often a blockage of the left anterior descending artery, a huge portion of the heart's pumping capacity can be lost almost instantly. Retention hook. This is the part most people don't picture correctly. A heart attack severe enough to kill often doesn't look like the movies. There's no dramatic clutching of the chest and collapse. Many victims describe crushing pressure, like an elephant sitting on the chest, radiating pain down the left arm or up into the jaw, and a creeping sense of doom that survivors consistently describe as unmistakable and different from any other pain they've felt. If enough heart muscle dies at once, the heart's electrical system can misfire into a chaotic rhythm called ventricular fibrillation. The heart quivers uselessly instead of pumping. Without a defibrillator within minutes, blood flow to the brain stops, consciousness is lost within seconds, and death follows within minutes. It remains one of the leading causes of death worldwide precisely because it can happen with almost no warning, in people who felt completely fine the day before. A stroke happens when blood supply to part of the brain is disrupted, but the hemorrhagic type, where a blood vessel actually ruptures inside the skull, is the more violently destructive version. Blood floods into brain tissue that was never built to contain it. Pressure inside the skull spikes. Because the skull is a closed box, there's nowhere for that extra blood to go. That pressure crushes and displaces healthy brain tissue, and if it isn't relieved fast enough, it can force the brainstem downward through the base of the skull. A catastrophic event called herniation that shuts down the centers controlling breathing and heartbeat. The onset is often described as the worst headache of my life. Sudden, thunderclap, unlike any prior pain. Depending on which part of the brain is affected, the victim may lose speech, vision, or movement on one side of the body within seconds, or lose consciousness entirely. Roughly a third to half of hemorrhagic stroke patients die within the first month, and for large bleeds, death can occur within hours if pressure isn't surgically relieved in time, making it one of the fastest ways a completely healthy-seeming brain can shut down entirely. Recap bridge. We've moved from fast bacterial killers to sudden cardiovascular events. Now we shift to something that kills through patience and stealth. Pancreatic cancer has one of the lowest survival rates of any major cancer, largely because the pancreas sits deep in the abdomen, tucked behind the stomach, where early tumors cause almost no noticeable symptoms. By the time warning signs appear, unexplained weight loss, pain radiating into the back, and jaundice, a yellowing of the skin and eyes caused by the tumor blocking bile flow, the cancer has frequently already spread to the liver or beyond. As the disease advances, the tumor can invade nearby blood vessels and nerves, causing severe, persistent abdominal and back pain that many patients describe as one of the most difficult symptoms to manage even with strong medication. The cancer also frequently triggers a wasting syndrome called cachexia, where the body burns through muscle and fat reserves faster than the patient can eat to replace them, leading to severe, visible weight loss in the final months regardless of nutritional intake. Death typically comes from a combination of organ failure as the cancer spreads to the liver, progressive malnutrition, and complications like blood clots or infection, in a decline that can unfold over many months even after diagnosis, a stark contrast to the sudden, minutes-long deaths we covered in the last two segments. Amyotrophic lateral sclerosis is, by most accounts from patients and families who've lived through it, one of the cruelest diagnoses in medicine, not because it's fast, but because of exactly what it takes while leaving the mind almost completely untouched. ALS attacks motor neurons, the nerve cells that carry signals from the brain to every voluntary muscle in the body. As those neurons die, muscles they controlled weaken and waste away, one function at a time. It might start as a stumble, a weak grip, a slur in speech. Over months and years, the disease methodically takes walking, then the use of the hands, then speech, then swallowing. Retention hook. Here's the detail that makes ALS uniquely horrifying to patients. In the vast majority of cases, cognition is entirely unaffected. Patients remain fully aware, fully themselves, trapped inside a body that is slowly, systematically switching off, limb by limb, unable to speak or eventually even blink to communicate, in what's sometimes called locked-in state in its most advanced form. The final and universal cause of death in ALS is respiratory failure. The diaphragm and chest muscles, like every other voluntary muscle in the body, eventually lose the nerve signals that drive them, and breathing becomes impossible without mechanical ventilation. Median survival from diagnosis is typically 2 to 5 years, though a small percentage of patients live far longer. It remains one of the only diseases on this list where the mind is the very last thing to go, arguably making it one of the most psychologically brutal deaths in modern medicine. Ebola virus disease causes what doctors call a viral hemorrhagic fever, and in the worst outbreaks, including the devastating 2014 to 2016 West African epidemic that killed over 11,000 people, fatality rates have ranged from roughly 25% up to 90%, depending on the outbreak and access to care. The virus specifically targets the cells lining blood vessels and disrupts the body's clotting system. Early symptoms mimic the flu: fever, severe fatigue, muscle pain. But as the disease progresses, the vascular damage becomes catastrophic. Patients develop bleeding from the gums, nose, and eyes, blood in vomit and stool, and bruising across the skin as blood leaks from damaged vessels into surrounding tissue. Recap bridge. Like cholera, Ebola kills partly through fluid loss. Vomiting and diarrhea can be severe, but unlike cholera, the fluid loss is compounded by the body's clotting system failing at the same time. In fatal cases, the combination of massive fluid loss, internal bleeding, and the immune system's own inflammatory overreaction, not unlike the sepsis we covered earlier, leads to multi-organ failure and shock, typically within 6 to 16 days of symptom onset. Survivors, meanwhile, can face long-term complications for months or years afterward, including joint pain and vision problems, a reminder that even beating Ebola doesn't mean walking away unscathed. Necrotizing fasciitis earned its nickname honestly. It's a rare but ferociously fast bacterial infection, often caused by strains of Streptococcus or other bacteria, that destroys the fascia, the connective tissue layer beneath the skin, at a speed doctors describe as almost unmatched in infectious disease. It can start from something as small as a minor cut, insect bite, or even a bruise with no visible break in the skin at all. Initial pain is often described as wildly disproportionate to how the wound actually looks. Agonizing pain from what appears to be a minor injury is one of the classic warning signs doctors are trained to catch immediately. Retention hook. The terrifying part is the speed. The infection can spread along fascial planes at a rate of up to several centimeters per hour, destroying tissue faster than surgeons can always keep up with, which is why treatment frequently requires repeated, aggressive surgical removal of dead tissue, sometimes leading to amputation of an entire limb to stop the infection's spread toward the torso. As the bacteria release toxins and destroy tissue, the same systemic collapse we saw in sepsis kicks in, blood pressure crashes, organs begin to fail, and without extremely rapid surgical intervention combined with aggressive antibiotics, mortality rates for necrotizing fasciitis remain frighteningly high, cited in various studies as anywhere from roughly 20% to over 30%, even with modern treatment. Every disease so far has had a villain you could picture: a virus, a bacterium, a tumor. Creutzfeldt-Jakob disease has something stranger: a misfolded protein called a prion, which isn't even alive in any conventional sense, yet spreads through the brain like an infection, forcing normal proteins to misfold in the same way. As prions accumulate, brain tissue develops a distinctive sponge-like pattern of microscopic holes, visible under a microscope, which is why CJD belongs to a family of illnesses called spongiform encephalopathies. The human variant most famously linked to consuming contaminated beef products, variant CJD, tends to affect younger patients and causes psychiatric symptoms first: anxiety, depression, withdrawal, before the neurological decline sets in. The classic form progresses with terrifying speed for a neurodegenerative disease: rapidly advancing dementia, involuntary muscle jerks called myoclonus, loss of coordination, and eventually a complete loss of speech and movement, often within just months of the first symptom. Compare that to years for something like Alzheimer's. There is no cure and no treatment that meaningfully slows the disease. Death, from complications like pneumonia as the body loses its ability to protect its airway, typically comes within a year of diagnosis, sometimes within months. Everything you've heard so far has a historical death toll in the millions or a documented, well-understood mechanism. This next one is different. It's rare, almost unheard of, and yet when it strikes, it might be the single fastest, most brutal death on this entire list. Naegleria fowleri is a free-living, single-celled amoeba that lives naturally in warm freshwater, lakes, hot springs, poorly maintained swimming pools. It's completely harmless if swallowed. The only way it kills is if warm, contaminated water is forced up the nose with enough force. Diving, water sports, even nasal rinsing with untreated tap water has been documented as a cause. Once in the nasal passage, the amoeba travels directly along the olfactory nerve, the nerve responsible for smell, straight into the brain. There's no blood-brain barrier to stop it, because it isn't traveling through blood at all. It's crawling along a nerve pathway that leads directly into brain tissue. Once inside, it causes a condition called primary amoebic meningoencephalitis, and it does something almost unimaginable for a single-celled organism. It begins to literally consume brain tissue, cell by cell, while triggering massive inflammation and swelling. Initial symptoms mimic bacterial meningitis: severe headache, fever, nausea, a stiff neck, appearing within 1 to 9 days of exposure. But the disease accelerates from there almost unlike anything else in medicine. Confusion, seizures, hallucinations, and loss of balance can develop within just a day or two, followed rapidly by coma. Here is the number that makes this the true climax of this entire video. The fatality rate for Naegleria fowleri infection is estimated at over 97%. Out of well over 150 known cases in the United States alone, only a tiny handful of people have ever survived. Death typically comes within 5 days to 2 weeks of the first symptom, driven by uncontrollable brain swelling that raises pressure inside the skull until it crushes the very brainstem structures that keep a person breathing. The same catastrophic mechanism we saw with hemorrhagic stroke, but caused by an organism you could scoop out of a lake with your bare hand, and one most people have never even heard of until it's too late. 14 diseases. 14 completely different ways the human body can fail. Some fast, some slow, some ancient, some quietly waiting in warm lake water right now. The one thing they all share is this: almost every single death on this list became less likely the moment humans understood exactly how it worked. Knowledge didn't just satisfy curiosity here. In nearly every case, It's the only reason survival rates ever improved at all. If the idea that a lake amoeba has an almost 100% kill rate messed with you, wait until you see what's still out there undiscovered in the deep ocean. That's exactly what we're covering next. Which of these 14 scared you the most? And is there a disease we didn't cover that you think deserves its own deep dive? Drop it in the comments, subscribe so you don't miss every deep-sea horror still unexplained, and we'll see you in the next one.